Good morning and welcome. You're listening live to Heart, a program which aims to help you understand and to become your loving self. I'm Dr. Mitra Rashidian. I'm a licensed marriage and family therapist and a certified sexologist in full-time private practice. And I'm here at KMET 1490 AM ABC Radio Live along with uh, Dr. Robert Jaffe, my colleagues, my business partner, my dear friend and best friend, and want to, welcome you back.
Thank you.
Okay, we had a program yesterday, but for those listeners and audience who, they usually follow us on Friday, they didn't know that, that you're back.
Right.
So welcome back,
Thank
and
you.
2 weeks of self-quarantine.
2 weeks of self-quarantine, and turns out I didn't have the virus, so that's good.
They miss you, huh?
And we have an announcement to everybody that this is going to be our last Friday meeting. We're moving to Thursdays. We're going to have a 2-hour program on Thursdays. The first hour will be on human sexuality and relationships, and the second hour will be on addictions and codependency and trauma.
Right.
And so we're looking forward to that. It'll be 3 p.m. and 4 p.m. again on KMET here Thursday afternoon.
And starting next week.
Starting next week. So we're looking forward to everybody joining us.
Right. Yes, exactly. And then we would like to invite you and to encourage you to please call us, ask your questions, give us your comments. And our phone number here live is 951-922-3532. We understand that if you want to talk privately, so our private contact information are also available at KMET, our page over there. And also you can visit us at our YouTube, eart-2-Heart.online/YouTube. And so Dr. Jaffe, Dr. Robert Jaffe,
yes,
we're talking about today trauma, codependency, addictions, and all of that impacting our relationships on a day-by-day basis.
Yes, and we've been talking about this ever since we started our program. It's been a number of months now.
Right.
And so today I thought we would talk about recovery from codependency, and so what does it take to recover from codependency? The first part is very clear that the biggest problem with all addictions, and codependency being the major addiction that is unidentified, the biggest obstacle to recovery is admitting that we have a problem.
So we're talking about awareness, right?
Awareness,
exactly. And I have a few clients that they are so in denial that they do have, an addiction.
Mm-hmm. Right. And of course, codependency being the largest addiction, and probably it's an addiction that is so pervasive that most people aren't aware that they are codependent or that they're in a codependent relationship, and they think that it's normal.
Right.
And if you want to define normal as common, then they're right. Codependency is very common, and so by that definition, it's normal.
Well, that's a very good translation. I like that.
Oh, okay.
Yeah. I mean, what seems to be normal? I mean, isn't this what everybody, everybody else does? Or, well, what else would you do? Or, that's how it is. It is what it is.
Mm-hmm.
But then again, the reality is that's what is common that most people follow. People follow what is common.
Correct.
But it doesn't mean that that's normal. You're right. I mean,
well, again, how you define normal. Yeah. It doesn't mean that it's healthy.
Yeah, it doesn't mean healthy.
Yeah, it doesn't mean it's healthy.
Usually when people talk about normal, they mean, healthy.
They mean normal, I think, usually means what most people do.
Right.
Yeah. So normal, actually, we need to differentiate, I think, from healthy, because, you know, most people drink alcohol. Is that true? No, maybe. Does that mean it's healthy? Right? And most people, let's say, fight with their spouses. Is that normal? Well, maybe, but does that mean it's healthy?
Right.
Right? So that's not to say that fighting occasionally isn't healthy, but certainly people who fight all the time, it's not healthy for them as an individual, and certainly not good for their partner and not good for the relationship.
Absolutely.
Yeah, so what are the essentials for recovery from codependency? And once again, for the listeners who are just tuning in, codependency we're defining as as an addiction to something or some feeling that comes up that is not related to your true inner self. So an addiction of codependency simply means that we are looking outside of ourselves for happiness. And so what do we think causes happiness? Well, is a big car, is a big house, is a swimming pool, is a diamond ring, is $1 million in the bank, is that going to bring us happiness? And those are things that we look at that are outside of us, and often people think that that's going to bring them happiness. And that's not to say that those things can't bring us pleasure. Those things can bring us pleasure. Certainly, if you have money, you can take vacations, and that brings you pleasure. Having a nice house, at the top of the hill, that can bring you pleasure. Having a swimming pool, having a jacuzzi, all of those things can bring you pleasure. But pleasure is not exactly the same thing as happiness. Do you agree?
Absolutely. Yes.
Yeah.
Pleasure, is one thing, and then happiness is another thing, and happiness, the true happiness, comes from within. There are people that they make a mistake between momentum of euphoria uh, versus they go for the momentum of euphoria versus learning how to be happy.
Mm-hmm.
And that's why people go back to their addiction even after sobriety. Right. And then I have a client here that he stopped drinking, and he was sober for about 6 months, and then in a moment of that he found some good news, but he grabbed a bottle of tequila and he drank it all.
Mm-hmm.
And he said, I'm celebrating.
Mm-hmm.
I said, well, you broke your sobriety.
Mm-hmm.
You're no longer sober.
Mm-hmm.
And then he said, no, that was just the moment that, that he wanted to celebrate.
Mm-hmm.
And I asked him, what other ways do you have to celebrate? And he couldn't identify one.
Right. Mm-hmm. Yeah. Yeah. And so what you're saying is so true. We are creatures of habit. Right. And so, especially with our addictions, we get into the habit, and you used a great word. You said euphoria, and our addictions can make us can give us a sense of euphoria, and can also give us pleasure.
Right.
So I'm smoking marijuana, having a drink of alcohol, or any of the pleasure drugs, some of which are legal and some of which are illegal, can give us pleasure. We can feel good when we're high. If that wasn't true, then nobody would do it.
Exactly. Yeah, all addictions gives us the sense of euphoria.
Well, yeah, all addictions give us a sense of euphoria, including gambling.
Right.
It changes your body chemistry. Sex could be an addiction.
Yes.
Right.
Having an affair is an addiction.
Having an affair, yeah, all of that can be an addiction. So now that we've identified that, what is the opposite? And what can give us happiness? And that has to do with uh, being connected with our loving, authentic, true selves. We are born, most of us, the great majority of us, we are born into the world with a loving, authentic, true self. And the first years of our life, we don't have our intellect developed, so our emotions tell us kind of what's going on and give us a sense of being safe and connected and happy. And so our understanding what's going on inside of us, how we're talking to ourselves, our viewpoint on things. Is the glass half empty or half full? Those are unique qualities that each person has within themselves, and the way that we look at ourselves, the way that we look at the world, and the way that we look at life and other people, those are the things that can give us true happiness. So why do people have social anxiety, right? Well, social anxiety just means that you're not looking at other people in a way that where you're saying, oh, those people are going to be fun to talk with, those people are going to be helpful, those people are going to like me. Social anxiety is saying the opposite. So pretty much we vacillate as human beings between feeling okay and feeling not okay.
Right.
And feeling not okay usually has to do with our adapted self. The adapted self is the self that we create in order to fit in with the family that we're raised in. If our family doesn't require us to adapt, but rather honors our uniqueness and our ability to be our true selves, we don't have to create an adapted self. We find that being our true selves, saying our truth, looking at things in a positive way, are validated by the people in our family, mostly our parents, and we aren't forced to comply with their view of the way things should be. And that's what our authentic true self is. It's our authentic view of things and our authentic belief that the world is a safe place and going to be a helpful place to us.
Right, and then this adaptation happens so slowly and gradual that, growing up, we don't realize that how we are letting go of our true self, and we are becoming that, that false self that our family, train us to be.
Right.
Right. Now, having said that, we're not saying that, all of these transactions are abusive. We're not suggesting that. But then again, at the same time, many of us, majority of people, will experience some level of trauma growing up because of the concept of, how we become that adaptive self of us.
Right. So I said today we were going to talk about healing, and from codependency, and so the first thing we need to learn how to do is to recognize that life is going to throw a lot of distractions at us.
Yeah. So why don't we? I think we are at our commercial break, and maybe we can continue with the identifying these distractions after commercial break. What do you think?
Oh, okay. Did you hear them say something?
I think I heard them something,
Okay.
So we have.
You were right.
Yes.
Okay. I didn't hear it.
Yes.
Okay. So we will come back and we'll talk more about this fascinating topic that affects the majority of people, which is our codependent self, healing from it, and becoming our loving, authentic, true self. So we'll see you in a few moments.
Thank you. Welcome back from our commercial break. Dr. Mitra and Dr. Robert here at the Heart-to-Heart program at KMET 1490 AM ABC News Radio. For those of you just tuning in, our discussion for this segment is about codependency and how to recover from that. Welcoming back to Dr. Robert Jaffe after his 2 weeks of quarantine. We're glad you're here. So please call us. Here's our live phone number at the station here, 951-922-3532. And please introduce this program to those that you believe they may benefit from. We appreciate that, and thank you for spending the hour with us. So, Dr. Robert Jaffe.
Yes, so I also want to remind everybody, which we said we're going to say this several times during our program today, that we are moving. Today will be our last show on Friday. We're going to be moving to Thursday afternoon
at 4 p.m.
At 4 p.m. And so it's going to be a 2-hour show. The first hour will be hosted by primarily by Dr. Mitra, and I'll be there also, beyond human sexuality, sexual relationships, and the second hour will be hosted mostly by me, and Dr. Mitra will join me. We will be talking about codependency, addictions, and trauma. And so we're inviting you all to come to our shows this coming Thursday. It'll start this coming week, 3 and 4 p.m. And today we're talking about healing from codependency. The first part of it, we said, is about getting rid of distractions. Distractions are things from the outside that keep us from focusing on our inner life. And what is our inner life? Our inner life is mostly about our emotions and our feelings. And it's very easy for people to not focus on feelings and to focus on things to do. So many people, I think it was John Bradshaw, who was a famous author about healing from codependency, and he coined the phrase human doings instead of human beings. And so I think it's important that you look at your life and ask yourself, does that fit for me? Am I human doing? And do I feel like there's always stuff more to be done, and my life is only good insofar as I accomplish things?
I mean, that's a great point. There is also a group of people that I come across that they say, I'm doing good. This is life. And they can't even go beyond the point that maybe this isn't really the life that, that they should have. Some people, they're not even at the place of recognizing that they are in codependency, right? And while they are suffering, they have such a strong belief that this is what God wanted for me, and this is where I am. I'm just going to continue with it. This is my husband, this is my children, or this is my wife, this is my job. And they just go through that routine every day and every day and every day.
Correct. Yeah, absolutely. And of course, we're not here to judge anybody's life,
right.
And we're not here to say that you're living your life incorrectly. But what we see a lot when people come into our office, now of course we're doing our sessions remotely because of COVID, but it doesn't matter. What we see a lot is people who are doing, often accumulating wealth, accumulating property, accumulating jewelry, accumulating clothing, and it's sort of like the expression, he who dies with the most toys wins, right? So what happens is if you get your pleasure from accumulating, you will accumulate a lot because that's what's turning you on. But it doesn't necessarily mean that you'll be happy. What it means is that you will get a high from the accumulation. So you make a new deal in business, You make another 1,000, 10,000, 100,000, $1 million, and you feel high from it. You go, wow, wow, this is great. Look at how much I made. And so, and so, although there's nothing wrong with that, that is not the same as enjoying your inner life and enjoying your relationships. And so uh, learning to live from our inner life is learning about our emotions.
Right.
And so what are we supposed to do with our emotions? One, we're supposed to recognize what emotions we're having. Second, we're supposed to not only recognize it, but actually feel it, but actually allow it to be felt in our bodies. Uh, we need to experience the feeling rather than just gloss over the feeling. We need to kind of let the feeling soak in.
So basically, we're talking about let's experience that somatic aspect of our feelings.
The somatic aspects, yeah.
Right.
Yes, exactly. So if I'm sad, for example, then I'm going to feel a heaviness maybe in my chest. I may feel that my eyes are getting heavy. I may feel them watery or tearing up. Um, I may start to think sad thoughts, and then I know that I'm sad. And so first I'm recognizing it, then I'm feeling it, then I'm experiencing it, and then I need to work it through. Well, what does that mean? What does it mean to work through a feeling? It means to allow the feeling to have its way with you for as long as it needs to. And so, for example, I was very close with my father. May he rest in peace. And when my father passed away, I was very sad. And I was sad and I cried probably every day for at least a year. At the beginning, I cried for more than once a day. I cried at the drop of a hat. But I didn't resist the feeling. I allowed the feeling to have its way with me. And then towards the end of the first year, I still felt sad, but it wasn't as poignant. It wasn't as sharp. And during the second year, I cried, but it wasn't every day. I cried at times. And then by the third year, I wasn't crying much. But when I was thinking of my dad, I was feeling some sadness, but I also was feeling some happiness. And then after the third year, the happiness sort of replaced the sadness. And so now it's been many years, and now when I think of him, I feel a lot of joy because we had some really good times together. And I imagine that I'm carrying his energy inside of me, and I can connect with that. That's an example of working through a feeling.
Yes.
Yeah.
Right. And then what we see, and that's a very good example. And as you talk about your father, I can see that your eyes became teary.
Uh-huh.
So you're still, have, your connection with your father. And you and I have talked about that occasionally. It's been incredible, right? And you're one of the lucky people who have had that relationship,
Yes.
And so on the other side of the equation is that we know that when a young boy, for example, and because you put yourself as an example, I'm referring to boys, when they start crying at the moment of sadness, they are told, men don't cry, strong boys don't cry, so stop crying. So that message by itself, is telling the young child that they're not supposed to feel their feelings, right? And I have a client that his father is culturally, and he's from a different culture, not from mainstream culture, that his son is very angry and sad about his relationship with his dad, and he's about 12. And then his father, the message that he gives him is, that the two of them need to talk, man to man, right? And then man to man means that he's not supposed to feel his feelings, right? And the child, every time he hears that, he gets so pissed off. And he says to me, he says, I'm so disappointed and so pissed off at my dad that he wants desperately to dismiss my feelings.
Mm-hmm.
You know, and then why can't he understand that I have feelings?
Mm-hmm.
You know, and but because he wants to maintain his connection with his father, when he's communicating with his father, he doesn't talk about his feeling and he acts tough.
Mm-hmm.
But then again, when he comes back to his mother, he starts to cry for hours.
Mm-hmm. Right. And so that's a wonderful example of our adapted self,
Right.
or our false self,
Right.
or our codependent self.
Exactly.
Yes, that's an example.
This is how it begins.
That's the beginning of it.
That's the beginning of it.
Yeah. Yeah. So, yeah, and then when you said, you saw my eyes tearing, I was actually feeling a little sadness, but mostly I was feeling happy.
Well,
So
yeah,
actually,
I'm saying that you let your emotion, to emerge. You don't hide them.
yeah, but what I'm saying is
Yeah.
the tears can be of joy as
Of
well
joy
as,
as well. Yeah.
but they're poignant. In other words, there's always some sadness in it, but it's not just sadness.
Just sadness.
Yeah,
Yes.
and so that's the working through of the feeling.
Right. I mean, I myself growing up, I was the firstborn child, and my job was to set up a good example, for my siblings and for my even younger cousins. So when you were a firstborn child in my family dynamic, it was as though I was the eldest child to set an example for even for younger cousins. And I do have lots of cousins, so go figure. So it wasn't just for my siblings, but it was for like maybe a group of 20, right, that I needed to set up an example. And one of the examples was that I needed to maintain my toughness, to not let anything break me down, or not to cry, or, and then, respect the family dynamic, and, not be emotional and all of that. Well, first, and I was again one of the lucky ones, because I always challenged that, but that was the expectation. So I could have become like one of my cousins or one of my siblings who actually they follow that policy, they follow that rule.
Right.
Yeah. And many did, but my nature somehow didn't allow me to stay in that, mentally stay in that dynamic,
Yeah.
But then again, I know from that group that I was set to be an example for the majority of them. I would say more than majority. Probably I was the only one that didn't fall for that trap.
Right.
But the rest did. So it's easy to, for the sense of safety, and because we need to stay connected, we go for that adaptation. We accept that adaptation without even recognizing that we're doing it.
Exactly.
And that's how, for example, I was called the scapegoat of my family.
Right. So those are what you do with your feelings. You recognize it, you feel it, you experience it, you work it through. And then what do you do with it once you work it through? Then you use it, just as you were using it right now, because the feeling informs you about what happened in your life, and then you talk about what happened in your life. So you're using that feeling as a way of connecting with your previous experiences. And that's what we call using your feeling, using it. And you have to work it through first, which means you have to let it settle in your body. And then what do you do with it? Well, then you let go of it, because you've worked it through, you've used it, and then it's gone. But it's not gone forever. It's still inside of you. So if we talk about it again, it'll still come up for you. So that's the healthy way of dealing with our feelings.
But the negative feelings and emotion, though, when they come back, this time they're not going to control us. We actually know how to understand them and, push them where they need to go, and continue with our happy life.
Right. Yep. So we talked about the essentials for recovery. One is handling distractions, meaning not letting work or accomplishing things run you. Is it important to work, and is it important to accomplish things? Of course. And we all want the fruits of our labor, And if we're lucky enough to have something that we enjoy doing and make money at the same time, that's even better. So there's nothing wrong with work, and work is, to quote a to quote a phrase from a book, one of my favorite books, um, by Khalil Gibran. Um, he says in the book, he says, work is love made visible. So if you're working at something that you love, then you're very, very blessed because you're creating something out of love.
So you and I are actually very blessed.
We are blessed. We're
seriously,
and
yeah.
we talk about that. Yeah. That book is called The Prophet.
Yeah. So we got the
got the notification that
right?
we got to stop again. So we're going to continue with healing from codependency, and our next topic on healing will be learning about age regression. Why is it important to understand what's happened to us in the past and understand our childhood?
Exactly.
So we will come back to you in a few moments and continue our discussion.
Welcome to our commercial break. This is eart-2-Heart program at KMET 1490 AM, ABC News Radio. Dr. Mitra and Dr. Robert here. Our phone number here live at the station is 951-922-3532. Just to give you an update, this is going to be our last show on Fridays. And we are taking this program and we are moving to Thursday afternoon at 4 p.m. instead. And on Thursdays, we have a 2-hour program. The first half of the program is going to be about human sexuality. And the second one is going to be about what we are presenting at this show. So we look forward to seeing you back, next Thursday for 2 hours. And we hope that program, being longer, gives you more information and more relaxing time for you to listen to us and to be able to, have ample time to contact us live on the show. And we are going to be missing Jesse, our, technical director, but that doesn't mean that we are not seeing Jesse again. So Jesse, thank you for all of the help that you have been giving us. And you know that, we have other things that we have planned to do together. So anyway, so we're not saying goodbye to Jesse. Therefore, so let's go back to our topic, Dr. Jaffe.
Well, we've been talking about healing from codependency. We have mentioned several of the components. We won't get through all the components today, but we've talked about handling distractions to recovery for the most part, which is getting your mind caught up in doing and accomplishing rather than moving into your feelings and being connected with your feelings in your body. We've talked about learning to live from our inner life, which are emotions. The things about our feelings, recognizing, feeling, experiencing, working it through, using the feeling, and then letting go of the feeling. And we're talking now about age regression. And age regression simply means that everything that's happened in our life is in the past, right? Except for this moment. This moment is in the present. What happened prior to our commercial break, that's now in the past. What happened a day ago, a month ago, a year ago, 50 years ago, depending upon how long you've been on the planet, that's all in the past. To ignore what happened in the past is to ignore a large part of what has helped to create who you are. Right? Every experience affects who you are. Every experience affects who you are because the way that you look at that experience is unique. There's never going to be, and there never has been, and there never will be another you. Nobody has the exact same view of life as you do. We all have similar things. That's why we can communicate, and that's why we can create together. But we don't have the exact same view. So, I'm reminded of that every time you, Mitra, and I we go out for a drive, and you tell me to note you notice certain flowers or you notice certain buildings, and you point them out to me, and I'm not looking at that, and I'm not aware of it until you point it out to me, and then I look at it and I go, oh yes, now I see it. So it's each person has unique abilities and unique ways of looking at things, and we can help each other by pointing them out and sharing our experiences. But no matter how much we do that, it'll never be exactly as we see it.
Right. Right.
Yeah.
Exactly.
Yeah. So going back to healing from codependency, every experience that we've had, and especially our childhood experiences, have informed the way that we look at the world and the way that we deal with our feelings and the way we deal with other people. And if we don't look at those things and we're not aware of those things, it doesn't mean that they're not affecting us. What it means is that they are affecting us without our awareness. And without our awareness, we can't make any necessary changes. It just keeps happening over and over again. So when we have what we would call and what other people call triggers, right? So if someone says a particular word, like father, okay, father can be a trigger word, mother can be a trigger word, and there can be thousands or more than thousands of trigger words that remind us of experiences that we've had, and all of a sudden we're having those feelings. If we're not of what we're being triggered, if we're not conscious of what is being triggered, and we don't know how to bring it up and talk about it in a way that makes sense to us and can inform another person, then those things remain mysteries. And so we just have these feelings or reactions to things without understanding why we're having those feelings and reactions. And so therefore, we are at the mercy of those feelings and reactions, and other people are at the mercy of our reactions without us being able to explain why we're having that reaction.
Right.
And those things are very, very powerful. And I've used the example, and I think you've heard me talk about my father when he would get intense. Sometimes he would get annoyed, sometimes he'd get angry. He would grit his teeth, and he would talk to me through his gritted teeth, and he would say, God damn it, don't you know any better? Da, 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 da. And whenever he would talk to me through his gritted teeth as a child, I felt really intimidated, and I also felt kind of embarrassed that maybe I had screwed up, and afraid, afraid that there was something wrong with me and that I wasn't smart enough. And I didn't, and he did that throughout my life up until I was about 30 years old. And when I was 30, I was actually in my own therapy, and I talked about it in my therapy that my dad, when he's disappointed or angry, he would grit his teeth and talk to me. And the therapist said, have you ever told him? And I said, what do you mean, have I ever told him? Well, he knows it, he's doing it. And the therapist said, well, maybe he knows it, maybe he doesn't know it, but have you ever said it to him? And I said, no. And it turned out that day, I went home and I was actually on the phone with my dad, and I felt him do it to me over the phone. I could hear him gritting his teeth. And since I had just talked about it and I was aware of it, I said to him, Dad, when you talk to me that way and grit your teeth at me, I said, it makes me feel really, really bad about myself and small, and I really wish you wouldn't do that. And then when I said that, there was silence on the other end of the phone. And there was silence, and I said, Dad. And there was silence, and I said, Dad. And there was silence, and I said, Dad, did you hear me? And finally he said, yeah, I heard you. And I said, well, you didn't say anything. And then he said to me something which really shocked me. He said, do I really do that to you?
Yeah.
And I said, well, what do you mean? You just did it. And he said, yeah, I know I did. He said, well, I got to be crazy if I did it because my older brother used to do that to me. And I hated it. I can't believe I've done that to you. And that's an example of why it's important to understand our past.
Right.
Because if he had known that he was doing it, and he had known why he was doing it, he would have been able to stop doing it. And from that moment on, he never did it to me again. Now that happened very quickly, and for most people, you have to remind them over and over again. But that's why it's so important to understand what happened about in different times in our life and how it affected us.
Exactly. And that's a good concept to use in a couple that I have, currently. And because the wife, for example, instead of referring to her feelings, she kind of degrades the husband by giving him some nasty words, right? So I guess this is what she has learned, how to be expressive.
Well, she's learned to defend herself by not looking at her part in it,
right,
or why she's having the feeling. She's blaming the messenger. She's killing the messenger, as they say.
Right. Yeah, exactly.
So what we do if we get triggered by somebody is it's easy to attack that person and say you're wrong for triggering me. Of course, we don't say that. We don't use those words. We say things like, why did you say that? Or I didn't like you, or I didn't like it when you say that, or that was mean, or and we're not aware that we have been triggered and that we have to take responsibility for our reactions.
Our own being triggered, yes.
So this is a big part of recovery in codependency, is learning about our past and learning about the things that we're still carrying inside of us, that are affecting us and our relationships. The next part of recovery is about grieving. And grieving means allowing the sadness of our losses to be felt until they're not felt, until they're not strong anymore. And I used the example before of my own loss with my dad, that I allowed myself to cry, and it was probably several times a day for the first several months, and then it was at least once a day for the rest of the year. And it would just come out of nowhere. I would just remember that he was gone, and I would start crying. And so, but as you allow yourself to grieve, the pain starts to subside. And as the pain subsides, you're able then to remember the good things about the person. However, if you don't allow yourself to grieve, what you do is you keep all that pain locked up inside of you. And when the pain is locked up inside of you, you become, I'm going to use the word prickly, meaning that you have all of these little places on you that can be triggered, because the pain can be triggered by any look that the other person gives you,
right,
or any tone of voice that the other person gives you, or any body language, or certainly any word that they use. And that brings out pain, and you're not aware of where it comes from, because you haven't allowed yourself to grieve the losses.
Well, that definitely makes sense. I mean, many people don't understand not only what the grieving process is, but they don't allow themselves enough time, to grieve, to go through the grieving. And that some of it has to do with the concept of, strong people don't cry. Strong people, don't suffer. Strong people are able to, handle their emotions. That meaning that strong people are not supposed to feel their emotions.
Strong people aren't supposed to feel vulnerable.
Yes.
Yeah,
right.
yeah.
Right.
And of course, what we now know from a psychological perspective is that the opposite is actually true.
Right.
That the stronger the person, the more they can allow themselves to grieve. And it reminds me of what happened. I was alive when John Kennedy got assassinated. and of course, later on when Martin Luther King was assassinated. And I remember watching the funerals on television and seeing John's wife, Jackie, and her children standing at attention when his coffin was being carried uh, through to the graveyard. And they were standing at attention and they were very stoic. And I looked at them and I thought, I would be like going crazy if it was my husband, you know. And then I remember seeing at Martin Luther King's funeral that his wife broke down and threw herself on the coffin. And when that happened, I got chills because I thought to myself, yeah, that's more real.
That's been real.
That's
Yes,
more human.
exactly. Right.
Yeah.
Right. And then what we don't realize is that when we talk about, somatic experiences of our feeling, actually tears, releasing tears, which what we know as crying, is the, physical, reaction of sadness.
Mm-hmm. Exactly.
Right. So it's not something that, we have physical reactions. So tears is one of them.
Mm-hmm.
And to hold that back is actually eliminating the process of full grieving.
Exactly.
Yeah.
Exactly. So there are many things that we need to grieve. I was watching a program on television, and there was a little girl on a ship, and she was standing by the railing, and she was playing with her doll, and the doll fell overboard. And she watched the doll fall, and it fell all the way into the sea, and then the doll was just floating in the sea. And she looked at the doll and she started to cry. Now, is that worth crying over?
Yes.
Is that something to grieve over? Mm-hmm. And the answer is yes.
Yes.
And if we allow ourselves to feel our feelings, we allow ourselves to feel the sadness of the minor losses.
Right.
And that enables us to feel the sadness of the major losses without getting stuck in having to resist.
Yes.
And we say that which you resist persists.
Persist. So we just got the signal that our show is about to end. We want to thank you all for following us on Fridays, and we look forward to seeing you back on Thursdays. And, we want you to be with us. We have so much to offer to you, and let us know what is it specifically that you wish to hear us saying.
Exactly. So Thursdays from 3 to 4, human sexuality, from 4 to 5, addictions, trauma, and relationships. And we really hope that you will join us and let the word out to everybody that you know that this show is for you, and we're hoping to see you there.
Thank you, and until Thursday, all you need is love.
All you need is love. Bye-bye.
Bye-bye.